Welcome to my review of Artifact 3. Artifact 3 is a presentation I did in Dr. Robertson's Staff Supervision and Development course, EDUC 5204G. I had the opportunity to present this review to the class. I did it on a volunteer basis. As I was in the middle of a fairly significant technology rollout at my place of work, and not only did I need to figure out how to be the change agent within that institution, but as the key supervisor, it's not a word I would have used, but as a key supervisor of the people who are in the particular technology rollout. How could I be an effective supervisor? So I volunteered to do this presentation based on that reason, but also because it was based out of the clinical practice, the medical field, which I was not particularly in at the moment, and I wanted to see what similarities there were. So, what was the purpose of the review? To review the literature on effective supervision in practice settings in order to identify what is known about effective supervision. So, why? Clinical supervision has a vital role in medical education. However, it's probably the least investigated, discussed, and developed aspect of clinical education. So, what were the conclusions of this fairly extensive literature review? Well, the big idea is that the supervisory relationships established are more important than the methods of supervision. So, in other words, that the actual human connections you make is almost more important than any sort of theory or model that you may follow. So, the key elements. Key element for is feedback from the supervisor based on monitoring and guidance. Input from trainee accepted and considered. Sufficient time for the supervisor must be provided. In other words, you need to have time with the trainee, with those who are going through their professional learning, so that you can help them along their path. Trainee, or I would like to call it professional learner behavior towards the supervisor, must be positive. Number five, that there's always a need for more empirical evidence, so you should always continue to be observing. So the methods adopted for this particular study was an examine of cross-disciplinary literature to identify what it could contribute towards answering the following 8 questions. Question 1: what are the understandings and definitions of supervision and its purpose? What is the empirical basis for supervision? What are the theoretical models of supervision? How is supervision delivered? What is its structure and content? Is supervision effective, and how can this be determined? What skills and qualities do effective supervisors need? What training do supervisors need, and how can its effectiveness be determined? And does the literature describe any other issues or difficulties? So, number 1, what are the understandings and definitions of supervision and its purposes? Supervision is usually understood as a distinct intervention, which is partially hierarchical and evaluative. But the debate is, should a supervisor be a manager, or should the supervisor also be the assessor of the trainee? So I referred also to Bridget Proctor's 3 Functions of a Supervisor from 1986. So the three parts of clinical supervision include the restorative, supportive, the normative, managerial, and the formative and educative. Looking at Kushin's model of supervision from 1976, we see that the supervisor and the supervisee are all linked by the administrative, the educational, and the supportive. So what three theoretical models are there of supervision? Well, most models support supervision approaches that are appropriate to the trainee's level of experience and training. But there is a caveat to that. There is limited empirical support for this proposition. So another issue is that there's no adequate accounts of supervision in the medical field. How is supervision delivered, and what is its structure and content? Well, formally, while a practice task is being carried out, or informally in one-to-one meetings, or perhaps in peer supervision. In group supervision with or without a facilitator, in networking, where not all participants work in the same place or in the same profession. Um, is supervision effective, and how can this be determined? Well, the quantitative data from the Harvard study within says evidence suggests that increased deaths are associated with less supervision of junior doctors in surgery, anesthesia, trauma, emergencies, obstetrics, and pediatrics. So you need to establish trust. What skills and qualities do effective supervisors need? Well, the bad supervisor, as quoted, is rigidity, low empathy, low support, failure to consistently track supervisee concerns, failure to teach or instruct, being indirect or intolerant, being closed, lacking respect for differences, being non-collegial, lacking in praise and encouragement, being sexist and emphasizing evaluation, weakness, and deficiencies, compared to the good clinical supervisor who is encouraging, who encourages communication between themselves and the trainee, appearing to enjoy teaching, being well organized, being a positive role model, facilitating learning and availability. So, successful supervisors must be competent and knowledgeable, have good teaching and interpersonal skills, give direct guidance, linking theory to practice, and give clear feedback about errors and weakness. Number 7, what training do supervisors need, and how can its effectiveness be determined? So it's not just up for those who are being supervised to be in professional learning, it's also for the supervisors, the leaders, to be in professional learning as well. So the need for training is widely accepted, and there is some evidence that it can be effective. Training probably needs to include at least some of the following: understanding teaching, assessment, counseling skills, appraisal, feedback, career advice, interpersonal skills, and understanding the concept and purpose of supervision. There also may be a need for criteria for entry into or satisfactory completion of supervisory training courses. Excuse me. Does the literature describe any other issues and difficulties? Yeah, quite a few. But I'm going to leave that for another day, and I'm going to get right to my reflection on this particular piece and how it helped me in my learnings throughout the MEd program, in my courses, and also in my professional career. Okay, thank you.